5 important ones: autoimmune, infectious, neuropsychiatric, ischemia, and also AIDS. Sarcoma. Again, like you're not gonna monitor these by yourself. You have to go back to the clinic, and the doctor will monitor. And if you do have these other diseases, such as anemia, relevant, when you put it together with interferon, it's gonna cause decreased blood count. So you want to monitor your CBC. Like I said, ribavirin is really the hemolytic anemia is one of the biggest things. The patient is gonna go into all these other complications if they don't have enough blood cells. And you want to, anything that blood touches, you want to go to cardiovascular, renal, so you want to cerebral and pancreas. Complication of treatments, like I said, in fact, you can have infection with HIV, that's going to complicate treatment. If you're co-infected with A and B, if you drink a lot of alcohol. And also if you're affected by different genotypes. So you don't usually get affected by many different other genotypes, but it's possible. You would treat, let's say if you have genotype 2 and 3, you will go with the genotype that has the longest length of treatment. If you have genotype 1 and 2, you will go with like 48 weeks. So that's basically it. And these are the monitoring parameters. Again, ALT or any other LFTs they want to monitor. Genotype 1, you monitor for a longer time. The reason why they said stop therapy if RNA doesn't decrease by log of 10 is because if the medication is not working, you don't need to treat it anymore. Because since it's not working, you have no other options and there's no other treatment. So there's no point of giving all these medications because they actually have higher toxicity. Because at that time, you have higher risk and benefit when you give out these drugs. So, new therapy. We have 2 new drugs, boceprevir and favipiravir, adding on to interferon and ribavirin. The chart that you're looking at now are the 3 most important things that pharmacists should know when it comes to treatments. Doctors, they can diagnose, this is what we have to know. We have to know the treatments. And for hepatitis C, it's really simple, it's just these. And a lot of doctors, if you don't answer, they're going to ask you about the new treatments. And they actually started using new treatments already. So I'm going to tell you guys what it is. Victrolis or boceprevir is actually a protease inhibitor. They never have protease inhibitor for hepatitis. They usually have it for HIV, AIDS patients. So same mechanism, inhibit the protease, inhibit the virus from replicating, and that's how you cure the disease. Boceprevir, this is the treatment guideline. You could, this is different. You need a 4 weeks of lead-in phase. I think they do this is to see if the patient can tolerate the other 2 drugs first before they start boceprevir, and then you can add on. But when you add on, it's only for a total of, I guess, around 32 weeks period. And again, like at week 24, if there's still RNA detectable, because by that time you should have zero HCV RNA. By that time, if it's still detectable, you stop the treatment. Like I said, if it's not helping, don't use it anymore. You're gonna have more risk than benefit. That's why there are these indications. Lead-in phase, 4 weeks, along with taking the ground around the first 4 weeks, you would use the 2 drugs only. You have to tell patients to take the 2 new drugs, because absorption that's affected greatly by the flu, 65%. So if you're not using it, if you're not taking the flu, you're actually not taking half of the drug. And this is pretty pricey. A month is around $5,200. Think about it, you have to use it for 52 weeks. No, 32 weeks, that's almost like half a year, even more. So by like 7 months, that's a lot of money. So as a clinical pharmacist, you have to make sure that patient's insurance covers it before you give it out. If there's prior authorization or anything that needs to be done, get it done before you start the treatment. It's like HIV medication, you cannot take a break. It's going to have resistance. It's contraindicated in a lot of drugs. All these you can go through them, but there's always an interaction, so you always need to monitor it. And all these are levels that could be increased by flucelapir. All these are levels that could be decreased by flucelapir. Again, a lot of drug-drug interactions, especially with HIV patients. And HIV patients are like the most troublesome and the most high-risk patient that we're going to have for hepatitis C. Another immune drug, instead of flucelapir, again, same mechanism, exactly the same. Hepatitis proteins. That's their logo. That's a pretty cool logo. This one, the difference about this is that it doesn't have a negative phase. You start right away, and you only use it for 12 weeks. The other one, remember, 32 weeks. This one, 12 weeks. That's why the price is different. They want to make all the money that they can make within the time. So if you compare both prices, they're almost the same. Because they got different timing. Don't just look at it as like, oh, shoot, the one it's going to be that pricey. So, thing about this drug is that anticonvulsant is not actually contraindicated. So, patient with seizures, complication, you might want to use this drug. Doesn't affect your level, especially MS1. Both of these medications actually have contraindication with the statins. The reason why they have atorvastatin over here is because they had study done with atorvastatin. With flucelapir, they haven't had study done, but I would assume it's still the same. But legally, you can use lipitor along with flucelapir, but not with this one. Everything else is the same except this one, another extra indication, erythromycin. Again, it's the same class, same mechanism, so you assume that they do the same. Just more study done for erythromycin. That will decrease by citalopram. And all you have to monitor is complete blood count. You have to monitor the RNA. You want to patient who's actually pregnant cannot be put on these two medications. So you have to give them birth control and also a non-hormonal therapy, I guess, to prevent cancer. And also monitor for drug interaction. It's a lot. Sponsors, like I said, you want to cancel them. These two are very high cost and they're challenging to use. So make sure insurance is covered. Consultations take exactly as directed. Don't skip any day or try not to. Continue the recommended two rival contraceptive, hormonal and non-hormonal. Also to prevent resistance, like they said 3 times a day, but some people take it with flu and flu schedule. They're usually like every 4 hours or every 6 hours. You want them to take it exactly 7 to 8 hours. Like spread them out throughout the day, so for the best efficacy. And again, warnings to refill several days ahead so they don't miss any dose, and advise all the adverse effects.